Reporting for Heart Rhythm TV, I'm Mehek Dande. At HRX 2024, Day 2 is a wrap. And I'm here with my co-host, Dr. Janet Han. Welcome back.
Thank
We've
you.
swapped positions. And so how was today, and what did you attend, and what did you like?
Yeah, so yesterday, obviously, we had a little slower start because it's like a half day, but today was a full day, and it was like lots of running between sessions, as always, lots of concurrent sessions, but everything was so good, it's really hard to decide what to go to, right? So the good thing is that they're all recorded, right? So we can always go back and listen to them podcast style. I started my day listening to Jen Silva and Maria Berkman talking about how to become a venture capitalist without really trying, which I'm like, can you really
Must
do
be
that?
nice.
Yeah, must be nice. But what stuck with me is one line that she had said, which is, the question was, what really is it that venture capitalists are looking for, or sort of catches their attention? And Dr. Berkman said, it is the first in class, the best in class, high risk, high yield or high reward things that really will change, standard of care for large populations, which I was like, wow, that is a quotable quote right there. So that really hit me hard, and I posted that out on LinkedIn as well. So that's some really, really good advice. So that was the first thing I started with. What about you?
Yeah, I was able to catch some of the keynote this morning with Jag Singh interviewing John Halamka.
Yep.
The topic of platform thinking is just so elaborate, and there's so many directions you can go with it.
Sure.
And Dr. Halamka did a really good job of highlighting the whole journey that platform thinking has taken, and how we can really use data, at least from large academic centers such as Mayo Clinic, where we have that high quality data, they have the resources and the right technical know-how to be able to map out patient journeys and predict what's going to happen next. And I know some data scientists at Stanford are looking at care pathways that can be predicted based on some patients' prior history. So that was really interesting, and also thinking about what impact it could have on emerging economies, emerging markets, especially emerging healthcare markets, and rethinking education was another angle that they talked about that was so interesting, because yes, the Krebs cycle, which was the example that came up, and the basis of drugs and physiology. Of course, it's very important. At the same time, and I hear this more and more from medical students and residents and trainees, that AI, ML, data science, just knowing exactly how these things work and what the lingo is, and also the more technical aspects of it, it's becoming more and more part and parcel of how we deliver care. So we're really doing a disservice in a way. We're definitely doing a disservice to our trainees who are not learning the basics of machine learning in this day and age.
Absolutely. Like where we are now, can you imagine even just 4 years later, if the newbies don't know, that's going to be a huge disservice, even if just to understand just the basics, right? So we're on this huge learning curve. They should really just do it foundationally and just learn as they go. So absolutely. I went off next to a couple sessions that I did. One was using AI to hopefully optimize clinical operations. Well, that was the title. It totally veered off into left field, which I thought was great, because we ended up talking about how maybe we should pump the brakes a little bit on AI when it comes to clinical operations, because we may be sort of enamored with the more sort of sexier parts of AI, that we're using ECGs to really diagnose things far into the future for our patients, but maybe we need to sort of start to look, at lower hanging fruit, right? Kevin Thomas was the one that said that. He's from Duke, and he really hit the nail on the head when he said, look, there are many things that we need to, in our day-to-day clinical operations, to just help our patients even access care, that we can't even do that. And we may not even need AI at this point to do that. We just need some quick and dirty yes, no, maybe even chatbot algorithms to just schedule our patients into the system so they can even enter the door so that they can get diagnosed with AI later. So I thought that was amazing that took a complete turn that I wasn't expecting.
Yeah, I think that's really insightful, because even when you talk about operations, it could mean a huge umbrella term, or it could mean supply chain, getting from a hearing aid prescription to actually acquiring the hearing aid. And you could use machine learning for it, but you don't need to. And that could really have a huge impact on healthcare. And even when we do talk about machine learning models, like a digital twin or predicting large scale outcomes is, of course, very fascinating. At the same time, there is opportunity in educating a patient on when might be a good time to get early rhythm control, when might be a time to seek help at a hospital and prevent those downstream complications of very sick patients getting to us very late, and of course increase cost of healthcare and poorer outcomes for our patients.
Yeah, we need to get people to fund those sorts of earlier starting things that are still needed and not forget about them, right? Because we're still on the ground taking care of patients every day, and that would be really helpful to have that.
Yeah, and one interesting thing that's come up from conversations is, when it comes to VC funding, of course, the model of if you're not losing enough money or not taking enough risk, you're not really doing it right, and sort of this early, high impact, high risk, high reward. If 1 out of 10 investments work, that's good enough. But the growth equity model, the private equity model, is more so along the lines of what you're saying, where it's maybe 2x is good enough return. But it's a more consistent return, and it's a more straightforward problem. And that actually reminds me of the pitch competition I was able to attend. It was, home care, titration of medication, dispensing medications, and checking compliance, and then some non-invasive measurement of wedge pressure, et cetera. And again, some really good feedback was around needs assessment, the must-have and nice-to-have criteria, and then figuring out what your actual SAM is, what's your actual serviceable estimate of market as opposed to the total addressable market, because your resources will limit how much service you're actually able to provide. And again, the question about one specific endpoint, one specific outcome, and making that as narrow as possible was really good feedback that I learned from. Yeah.
Absolutely, yeah. So then I rounded my day out with the media panel. I guess it was the first of its kind at HRX, now in year 3. So it was great. Like, I got to put journalists in the hot seat. They don't usually get into the hot seat, so I got to pepper them with some questions. And I think it's pretty essential to understand how media works, right? When you have your widget that you want to get out into the market, maybe how is it best to form those relationships with journalists, and how to keep those relationships from being just purely transactional, right? How to pitch to them, how to make sure that really, you're telling your story not just about just the data, right? You want to make sure there's a human story that, is behind that story, right? How did you get to think about this widget? How did you struggle in your journey there? And how maybe it's going to help people in the end. So I thought the media panel was a lot of fun. And I hope that they can continue that in the years to come, for sure.
Yeah, it's really helpful. And now more and more, blog posts and updates about companies are becoming very quintessential to not just the public perception of a company, but what is your mission? What is your vision? As you said, what's the vignette? What's the one face or the one incident that led you to where you are? And that's what folks make decisions based off of. And we're seeing more and more of a B2C component in healthcare. It started out maybe with Apple Watch, and we still question if these technologies are really accessible to all our patients. However, directly marketing to patients has become more and more common now, and patients are very aware of the technologies available. And so I think journalism and messaging is very important.
100%. 100%.
Well, thank you so much for sharing the exciting parts of your day with me.
Great day.
And it's been a wonderful day. Looking forward to tomorrow. We have one more day to go, and it's been a wonderful conference so far. So thanks for joining me for the wrap up.
Absolutely.
And for more hot off the press content from HRX 2024, follow us on YouTube, LinkedIn, and X. That's a wrap.